Hello and welcome to Medical Dialogues. I'm Dr. Ganma Soni and let's look at today's top medical news. Study finds the upper respiratory tract microbiome is influenced by age, sex and lifestyle factors. In a recent study published in the journal Cell, a team of researchers in the Netherlands analyzed nasopharyngeal, oropharyngeal and salivary samples across various age groups and analyzed the microbial composition of these samples to determine the association between the microbiota in the upper respiratory tract and the health of the host and environmental factors. There is now extensive evidence showing that microbial communities within the human body are crucial for health and disease. Although much of the research has concentrated on the gut microbiome, studies have demonstrated that the microbiome of the upper respiratory tract is closely connected to respiratory health. It plays a significant role in influencing susceptibility to respiratory infections. In this study, researchers examined the microbiome composition and diversity in nasopharyngeal, oropharyngeal and salivary samples from a cross-section of the Dutch population. Their aim was to characterize changes in the upper respiratory tract microbiome across different stages of life and investigate its association with the host and environmental factors. Study finds having a higher BMI in early adulthood is associated with an increased risk of cardiovascular disease. In a recent study published in the Lancet Public Health, researchers investigated the association between early adulthood body mass index and cardiovascular diseases and the effect of midlife lifestyle factors on these outcomes. The study's findings suggest that a higher BMI in early adulthood is linked to an elevated risk of developing cardiovascular diseases. This highlights the importance of preventing obesity and managing weight during early adulthood to support cardiovascular health later in the life. The researchers tracked participants aged 30 to 79 from 5 urban and 5 rural regions. Between 2004 and 2008, they collected data through interviews, physical measurements, and written consent. The study excluded the individuals with a history of heart disease, stroke, cancer, or diabetes at the start, as well as those who were not within the 35 to 70 age range or lacked BMI age for age 25. Participants self-reported their weight from early adulthood and BMI was calculated using this weight and their height at baseline. Lifestyle factors including smoking, drinking, physical activity and diet were evaluated through questionnaires. Study reveals incorporating metastasis-directed radiation therapy enhances progression-free survival in patients with metastatic pancreatic cancer. In a recent study published in the Journal of Clinical Oncology, researchers from the University of Texas MD Anderson Cancer Center demonstrated that adding metastasis-directed radiation therapy to standard of care chemotherapy improves progression-free survival in patients with oligometastatic pancreatic cancer. At a median follow-up of 17.3 months, PFS was 10.3 months in patients who received metastasis-directed therapy plus chemotherapy compared to only 2.5 months in those who received a standard chemotherapy treatment. Additionally, increased immune response from MDT were connected to a longer survival times. Metastatic pancreatic cancer spreads rapidly to vital organs, posing significant challenges for disease management. Diagnosis often occurs at an advanced stage, reducing treatment efficacy and decreasing survival rates. The disease's complexity and resistance to many therapies also contributes to its poor prognosis. Chemotherapy, the main treatment option, generally offers a 7-month average survival time before disease progression. Increasing fruit and vegetable intake to reduce dietary acid can lower blood pressure and enhance kidney and heart health in hypertensive patients, study finds. A recent study published in the American Journal of Medicine, doctors recommended making fruits and vegetables a foundational part of the treatment of patients with hypertension. Diets high in fruits and vegetables are found to lower blood pressure, reduce cardiovascular risk, and improve kidney health due to their base-producing effects. Despite ongoing efforts to improve hypertension treatment and reduce its adverse outcome with pharmacological strategies, hypertension-related chronic kidney disease and its cardiovascular mortality are increasing. Heart disease is the #1 reason that patients with chronic kidney disease die. The dietary approaches to stop hypertension, diet that is rich in fruits and vegetables reduces blood pressure and is the recommended first-line treatment for primary hypertension. Nevertheless, this diet is underprescribed and when prescribed is underimplemented despite supportive epidemiological data. The DASH diet and other generally high in fruits and vegetables are associated with lower blood pressure, lower risk for and progression of chronic kidney disease, lower cardiovascular disease risk indicators, and lower cardiovascular disease mortality. That's all for today. Thank you for watching Medical Dialogues. Stay tuned for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.